morning, everybody. Welcome to the March HICP meeting. We're so excited to have everyone with us here today. As many of you will remember, it was a year ago that we started hosting our virtual. Well, that was a lovely introduction I was sharing with myself. So welcome everyone to the March 2021 HICP meeting. It was 1 year ago that we hosted our first HIPC meeting via Zoom, and we have 1 year under our belt as of this month. The wonderful thing about it is, of course, we've expanded our reach and more people than ever are joining our meetings. It's delightful to see everyone continue their support and interest in this equity table discussion and conversation around the health and well-being issues of the communities around the LAC USC Medical Center. Anna, if you'll go ahead and stop sharing your screen, I'll go ahead and start sharing mine so we can kick off the presentation today.
All right, you should be able to share.
Great, thank you so much. Okie doke. So here we are, March 5th, 2021, ready to kick off another fantastic HICP meeting. We have wonderful presenters and experiences to share with you today. And once again, we're so grateful for your time and attention to these important issues affecting our communities, particularly during these unprecedented times of the pandemic. Before we get started, I want to mention that, of course, March is Women's History Month, and we have a lot to celebrate this year vis-a-vis the successes of women leaders around us. I want to acknowledge the first ever all-female Board of Supervisors for LA County. Congratulations to all these fantastic women leading the largest county in America. And also to recognize, of course, that we have a woman in the second chair at the federal level too, with Vice President Kamala Harris. So this truly has been an unprecedented time in so many ways. There is a lot to, to mourn, but there's a lot to celebrate. And we're really excited to get to share this time with you today. With that, we'll go ahead and get started. As we know, we host our meetings via Zoom, and we ask for you to please keep yourself muted unless you are speaking. We also have simultaneous translation available at the bottom of your screen. You can click on the language of choice, and we ask that everyone please choose a language of choice so that the simultaneous interpreter can share Spanish into English or English into Spanish as you need. So please, everyone, if you would right now, go ahead and select the interpretation language of your choice. If at various points in the conversation today, we want this to be very interactive, so we will ask people for questions after every presentation, but also you're always welcome to raise a hand so we can call upon you to ask your own question. You're always invited to put comments and questions in the chat, and those will be read aloud throughout the meeting as well. As we kick off, I'd want to remind us all of our guiding principles, the elements that we've agreed to mutually to help, put guardrails? That's not exactly the right word. Anyway, some of our guiding principles that help us identify how we want to come together and how we want to share ideas and really make this a table of conversation and of progress towards mutual goals. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design. I'm so sorry, I actually can't read the final word because it's cut off on my screen. So my apologies, everyone, for not being able to kind of reach the final principle. Okay, moving on. A quick overview of our agenda today. We've just covered our welcome meeting overview and guiding principles. Next up, we're going to hear from Jorge Orozco, the CEO at LAC-USC, to share with us what's happening on our campus. Then we're very delighted to welcome some representatives from Councilmember Kevin De Leon's office to share with us some of the exciting work that the council member has tackled in his first months in office. We will have a COVID update from Supervisor Hilda Solis's office, looking at how the COVID pandemic has impacted the communities of the First District. And then we'll be hearing an Opportunity Zone update on the policy recommendations that are going forward to LA County. And finally, we will end with a comprehensive workforce development conversation, looking at some of the many exciting things that are happening to help empower the workforce in Los Angeles County and help restore the economic well-being of our community in the new era of the mid-pandemic to post-pandemic times. With that, I invite Jorge Orozco to take it away and share with us updates from the campus.
A pleasure to be here to work with our thought partners and really movers and shakers in our community. Our hospital is reflecting what's happening in the rest of LA County. The numbers are significantly down. We currently have 50 COVID patients in-house. About half of those are in ICU. So as the numbers continue to drop, we're starting to see a leveling off at around 50, where we see between 5 and 10 patients showing up to our emergency room with COVID. The good thing is the majority of those patients aren't showing up with the significant respiratory disease that we saw during the surge. Many of these come in as, with other conditions and trauma. And then when we test them, we see, oh, by the way, they also have COVID. So we're hopeful that this continues to go down, even though the decrease is slowing down. But we are hopeful. Hopefully we can get through this and sort of move on with our lives. The main focus of our hospital right now is to bring back all of our surgical services, all of our clinic services, and address the significant backlog of tests and procedures and surgeries that have accumulated over this last year. And so we are ramping that back up. We are also establishing contracts with outside community providers so that we can address this backlog and send patients outside of our hospital for those tests and those procedures that we can send out to. The other big initiative is vaccination. We have vaccinated over 9,000 employees. We're vaccinating our patients right now. And as the tiers expand, we're continuing to expand our ability to deliver the vaccines to our patients. It looks like the supply of vaccines is opening up. So I'm very hopeful that we can continue to expand the population that we're serving into the future. I think one of the things that I just wanted to highlight is, when people who have visited the hospital often comment during this pandemic, wow, it seems so peaceful here. The waiting rooms and the lobbies are empty and people are walking around with masks. But I don't think people have realized the tragedy that has been happening to our communities in a way that is real, in a way that really reflects how our communities have been disproportionately hit. And we have been trying to get that word out to the communities so that there is a sense of urgency to address the safety of our community. We about a month ago, we invited a Pulitzer Prize winning photographer from the New York Times to our campus to help document what is going on. And that article was just published this last Sunday in the New York Times Magazine. And I'll ask Rosa or Heather to post a link to that article. And I think it's a very telling photo essay. And it's one that gives, I think, people a unique insight into really the tragedy and the difficulty for our staff, the difficulty for family members going through this, and the impact. So I invite you all to look at that and share your comments. And with that, I'll take any questions.
Okay, this is Monica. My question is, you said that you vaccinated about 9,000 staff. Like, how many staff is there? I'm just going to assume that some people probably didn't want to get the vaccine, or maybe everybody did.
Yeah, we have about 10,000 staff now. The staff in that 9,000 also includes other hospitals in our DHS that have come to our site for their vaccination. So we're running about high 60%, close to 70% of our staff are vaccinated. The vaccine is not mandatory. And there are many who have advocated, and I am one of them, to make it mandatory for hospital workers, but at this point it is not mandatory, and I don't know of any hospital that is making it mandatory. So we continue to do outreach. We outreach certain departments that have lower uptake rates, and encourage. We have a campaign where we show our staff and have them reflect why they've taken the vaccine. So we're continuing to work on that, and hopefully our numbers continue to grow. I see other hands.
Jorge,
Hey, Ozzy.
Jorge, good morning. This is Ozzy. How are you? Buenos días a todos. So just wanted to check in from the community college's perspective once again with regards to clinical placements for students that are in need of fulfilling their hours. Can you share any information in terms of is that process going to reopen? Has it reopened? Or how can colleges re-engage with the hospital?
Yeah, if the community college has an existing relationship with the hospital and the medical center, and that relationship has been put on hold because of the pandemic, we are moving fast to reopen that. We still are very cognizant that COVID exists, COVID continues to spread, but we have continued to have medical students and nursing students come to our campus for their training. And I'm happy to engage in particular programs that need that kind of access, Ozzy. So if you send me an email, I can connect you with the right person to start that conversation.
Yeah, that would be great. I'll follow up with an email to you, because what I think I'd like to be able to do, if you're open to it, is identify the schools that have a partnership with the hospital. And instead of engaging in multiple conversations, maybe get all of the deans and department chairs to meet with your staff all at once.
Great.
So that there's alignment and communication. Cool. Thank you, Jorge. I appreciate it.
Sure.
We have a question or comment from Juana Mena.
Señor Jorge, buenos días.
Yes.
Mi pregunta es, por ejemplo, las personas que llegan ahí contagiadas del virus, pero que se pueden ir a su casa, cuando ya son dadas de alta, ahí mismo les están aplicando la vacuna o están esperando a que tengan el límite de edad, que ahorita es 65 años.
Sí, los pacientes que están internados en el hospital y están calificados para la vacuna, yo creo se les ofrece la vacuna ya saliendo del hospital. En el hospital no estamos vacunando. Sí estamos vacunando a algunos pacientes que vienen de la cárcel a los cuidados aquí en el hospital, pero a los demás les damos citas para regresar a recibir la vacuna.
Ok, porque todavía es muy pronto decir cuándo se va a empezar a aplicar la vacuna ya en general, sin importar el límite de edad, ¿verdad?
Sí, piensan que a los últimos de mayo a toda la población de 16 para arriba. La vacuna para menores de 16, ojalá pronto sabemos si vamos a poder dar a esa población.
Porque con esta nueva variante que está saliendo del coronavirus, la verdad, personalmente, yo sí tengo un poquito de miedo, aunque ya tengo mi primer vacuna, pero no dejo de tener miedo.
Claro, claro, debemos de tener miedo y debemos de seguir con las máscaras, con lavar las manos y no juntarse con gente.
Gracias.
Gracias. Okay.
Excuse me. Any final questions for Jorge? Well, thank you as always, Jorge, for sharing. It's very, and just to mention to everyone, Connie Castro shared a link to the New York Times Magazine article in the chat. And I've also downloaded a copy of the article in PDF. I can email around to everyone after the meeting if that's more helpful. So thank you so much, Jorge, for once again, the incredible work for you and your team, and also for reminding us to reflect on the struggles and challenges that we've experienced to date and that continue for so many in the community.
Thank you so much.
Thank you, everyone. All right, so we will move on. I'm very excited. Next up, we have a presentation by our colleagues in Kevin De Leon, Councilmember Kevin De Leon's office. I'm delighted to welcome Nate, Sarah, and Lucy, who are joining us here today to share some of the progress and programs that are underway in the council member's office. Nate, Sarah, Lucy, please. Welcome to HICP.
Great, thank you so much. Can you guys see me okay?
We can see you fine, Nate.
Good morning, everybody. My name is Nate Hayward. I'm Capital Projects Director for Councilmember Kevin De Leon of the 14th District, who covers, as we know, a majority of the area around the health science campus. So we're here obviously today to talk about homelessness and some of the initiatives the council member is taking, as well as the rest of the city council around homelessness. But before we do so, I want to introduce my colleagues, Sarah and Lucy, who can, they'll introduce themselves, but also talk a little bit about their role and what they do, which I think will be critical for this group going forward, as well as other things that you guys might need in the general area. So, Sarah, do you want to start?
Yeah, buenos días a todos. Sara Palacios con la oficina del concejal Kevin De Leon. Thank you so much for having us here in this role playing community affairs director and really helping tie together all of the, not just the folks on the orgs on the ground, but really just even citywide organizations that that really are just working for Los Angeles and connecting all through the council member's office, through the council member. So if you guys have any needs from the office when it comes to nonprofits, organizations, business orgs, and the like, please reach out to me. I will put my email in the chat. And really looking forward to getting to know the folks in this group and creating a working relationship. Thank you.
Good morning, everybody. My name is Lucy Aparicio. I am the area director for Councilmember Kevin De Leon. I am on the ground in the community, working with the community groups, the orgs as well, and obviously the constituents. I look forward to these new partnerships, and please don't hesitate to reach out to me or our Boyle Heights office. Again, for any possible partnerships and also any needs that you guys may see out there. that you guys may receive from any constituents as well, for city services and any other efforts. I really quickly wanted to share with you guys, obviously right now, one of the priorities for the council member as well is the vaccinations. So I do want to share, we actually do have a CD14 mobile vaccination clinic with the mayor's office. We actually have already had it in the Boyle Heights area for 2 weeks last month, and we will continue it again actually next week, starting on Tuesday, March 9th. It'll be Tuesday, March 9th through Saturday, March 13th. I'm happy
Good morning, Brenda. We will Frankenstein.
I'm happy to follow up with a flyer to share these details. It's actually
have the vaccine
building on Soto and Olympic, and we are taking appointments. So people can call our office to schedule an appointment. I'll also share our phone number in the chat box so that you can also share this resource. Obviously, this is for eligible Angelenos, obviously 65 and older, and also the essential workers in healthcare, food, agriculture, the eligible phase right now. So definitely very happy to be providing that, and we know that there's that need. So please help us share that resource as well. Currently, we also have in honor of Women's History Month, we do have a women's donation drive. This is to benefit women, unhoused women in our communities. We're taking donations. The donations that we're asking for are feminine and hygiene products. For example, body lotion, deodorant, mouthwash, those kinds of items. And these items can be dropped off at our field offices. So that includes our Boyle Heights City Hall office, our Eagle Rock City Hall office, and the El Sereno Constituent Services Center. While the offices are still closed to walk-ins, we are still checking these items. These are community buildings that are still open. And so we ask you guys to also help us share this donation drive as well. Like I said, I'll put the information in the chat box, and I look forward to working with all of you.
Great. Thank you so much, Lucy. I really appreciate it. And Sarah, thank you guys. We're very, very lucky to have a very engaged team that really is genuinely invested in the community and wants to really make change in partnership with the community and figure out how we, as your elected office in the city council, can really help lead the charge for the community's issues and really help get things done. So
Nate,
now
I'm sorry, if I could add just 2 more items, sorry. I also wanted to share that we do also have masks that we are providing to organizations or community groups, businesses. So if there's any need, please also share that as well to contact our office for a donation of masks. And we also do have our CD14 beautification team, which helps supplement city services and does trash abatement. So if there's any need for that, please don't hesitate to contact our office.
Great, thank you. So now I'm gonna, can I share my screen with the PowerPoint? Am I able to do that?
Yeah.
Okay, I made a couple edits on it, that's why.
Okay. Then let me, oops, pardon me, stop share. And then I think, Nate, you can take it away.
Great, thank you. So, can people see my screen?
We got it.
Okay, so I want to, we're here to talk about the council member's Away Home initiative, which is essentially his goal to address homelessness in the city of Los Angeles, which we know is a massive issue, but he feels very strongly that if we don't have a goal, we're never going to get there. So it's obviously a comprehensive plan to address our homelessness crisis, but we are the nation's epicenter for homelessness. Essentially, we have, sorry, I'm trying to move this here. We're our epicenter for homelessness. And we all know that because CD14 is ground zero, as you can see, if you go downtown in Skid Row. This is our reality. 41,290 people are homeless, both sheltered and unsheltered. I'm gonna say that again, 41,290 Angelenos are homeless, both sheltered and unsheltered. That's larger than the city of South Pasadena and many other cities in LA County. So if you think about the magnitude of that, it really highlights how big our issue is. And I think it's very easy to see numbers and be like, oh, wow, that's a number, right? But attaching a human face to each one of those numbers, I think really puts in context, right? You know, that every one of these individuals has families, has lives, has hopes and dreams just like all of us. And it's critical that we address our homelessness crisis in a compassionate way that gets us to our goals. And obviously, CD14 is the largest there, 7,617 unhoused individuals. I'm going to show you Santa Monica, 907, Long Beach, a little over 2,000, Houston, 3,500, Oakland, Chicago, Sacramento, San Jose, Phoenix, San Diego, I think this is the last one. Council District 14, just our district, has more homeless than all of these cities, as you can see. Some of these cities, I think Houston is the 3rd or 4th largest city in the country. Chicago is the 3rd largest city. Yet that just shows the magnitude of our homeless problem. And I think, you know, that really, you know, we can't ignore this any longer, and we can't not put all of our resources, our collective resources as government towards a solution. So in order to do that, the council member really wanted to take what is our local solution, because what we've been doing is litigating. All we're doing is addressing the homelessness crisis by litigation. These are just all the lawsuits going on or that have been finalized by the courts. And you can see that when we're making decisions by lawsuits, we're not actively being proactive in how we're addressing our crisis. And when we're, you know, leaving it to the courts to address something because we haven't, as a city, really taken the necessary actions, it puts us in a situation where we can't think as creatively or flexibly as we need to in order to address our issues. So what's the goal? 25,000 new units by 2025. And this goal includes a lot of things: permitting, plans, which I'll get to in a second, prefabricated housing, adaptive reuse, master leasing, new requirements for temporary shelters, home key, public land. We don't see this 25,000 units as all one type of housing, right? Because our homelessness crisis is a progressive issue, right? You have people that fall into homelessness, right? Because of many different reasons. Maybe they lose a job, maybe they have massive medical bills, right, that they can't afford. They can't afford their housing, so they end up living in their car. And then they lose their car and they live on the streets, right? So addressing our inflow is a critical component of this, which I'll get to a little bit later. So we see our inflow portion, temporary housing, and permanent housing. We're well aware of the costs of building permanent housing, which I'll go to in a second. But that's why we see it as a three-pronged approach. By addressing and reducing our inflow, doing temporary solutions that are cost-effective so that we can at least get a roof over people's heads, as well as focusing on our end goal, which is permanent housing. The council member feels very, very strongly that temporary housing, even though we're doing it, is not the permanent solution. We want to have a bona fide roof over everyone's head. That means those 41,290 people need to have a place to live, a place that they can call home. That's why this is a way home. So essentially, our goal involves doing a lot of things. We need to make it much easier to build in Los Angeles and to build affordable housing. That means we need to make it easier to permit projects. Sometimes it can take 3 to 4 years for a project to start their idea to actually putting shovels in the ground. And what that does is it creates, not only is it extra cost, but it's also time that those 4 years, even if you were to reduce that 2 years, is a time that someone could be in a home, right? So we as a city need to do everything we can to streamline the permitting process. We need to have standard plans, things that are already approved by the city that make it easier. And those would be such as prefab modular housing, which means that they don't need review individually for each product. We also need to look at our existing buildings, right? It's not just building new. It's looking at how we reuse our existing buildings that exist out there, right? Whether they be commercial buildings all over the city. Master leasing, thinking about ways to work with property owners. Redefining our requirements. I could go on and on, but we see this as a multi-pronged approach. So HHH, that's what we all passed in 2016. 10,000 units, $1.2 billion. And the controller did a report that looked at the cost of the HHH units. 531,000 a unit, city subsidy of 136,000. So what that means is of that 531, 136,000 was city HHH commitments. So what we see is, we're understanding of the existing system that works. And when HHH was set up, that city subsidy was put in as almost as a first in source of funds. So that a developer could have a commitment saying, I've got $136,000 a unit from the city of Los Angeles that I'm going to go use to find other funds. The difficulty in that is that there are many different systems from state, county, federal about how money is distributed. They all have different requirements, right? So what it's made it is developers obviously have to hunt around to fully cover their project costs. And this adds time and money. And this is one of the reasons we've got to $531,000 per unit. So what we want to do is want to clarify our projects in pre-development, see where they are, see how we can work with developers that aren't as far along in being able to think creatively about how we, get the units online faster, and how we look at, moving around money or different sources, et cetera, or ways just to cut scope, not unit scope, but cut other things as part of the project that drive up cost. So we started with 25 motions. 9 motions. I'm gonna put them all here for everyone to see. So first we adopted the 25,000 by 2025 goal as that overarching North Star, as the council member calls it, which is to build 25,000 units by 2025. Some of those will be temporary, some of those will be permanent. Obviously the temporary ones are gonna need to become permanent at some point in time, which based upon what we're looking at in terms of timelines, realistically, we think would be after 2025. But we still could get 25,000 people off the street by 2025. So we also did these other motions that I mentioned: pre-approved housing, streamlined permitting, maximizing our city-owned lots, redefining requirements for temporary shelters, expansion of project room key, so looking at a lease to own, evaluation of our HHH projects, looking at funding reconsiderations for projects that might need a little sort of, re-looking at to see if they're feasible and can produce the most amount of units as quickly as possible. And then really to reduce inflow, creating a permanent renter's aid registry. So what that would do, the goal is to really make sure that renters have a portal and have a real ability to know the resources available to them, such as the $259 million that I think City Council just approved this week, which will go to rental relief. So it's how do we really make it as easy as possible to know how bad our inflow problem is? Because we can build thousands of units as we are now, but if we can't address our inflow, you're literally just a waterfall of people coming in and you don't have enough, you're putting them through a funnel and only the people through the funnel get housing. So in green here, these are motions that have been adopted by the full City Council as policy that are going to be proceeding forward. The pre-approved housing, we're working very closely with our partners in the Bureau of Engineering, and we introduced this with Councilmember Bob Blumenfield, looking at how we work with the private sector, as well as the city departments to figure out if there's ways to do pre-approved housing. And that's looking at things from multifamily housing to bungalow housing to accessory dwelling units, the different models to figure out how we can get them approved. There's a lot of ideas out there, but how do we make sure that they're already approved so some things can be used over and over again without needing to redesign it many times. Streamlined permitting. Our goal is that for projects that produce the most amount of affordable housing are the ones that are prioritized. Right now in the city of Los Angeles, if you want to build something, you get in line just like anybody else. And if you have money, you pay for an expediter or someone who can help get you through the permit process, or you pay expediting fees to departments so they prioritize your projects. The reality is a lot of the people that can afford that are the ones building market rate housing. And departments, per current policy, have to review things in a certain order. So what we're trying to do is create a system, a tiered system where we're prioritizing the projects that are most addressing our affordable housing crisis. So for example, a project that produces 100% affordable housing and permanent supportive housing would be prioritized. And our goal would be to get the city to respond to a affordable housing developers, what they transmit to the city as fast as possible in 15-day turnaround. We don't see that as eligible for every project. And part of the reason for creating a tiered system and by creating certain dates is to encourage people to go to the next tier system. Even people that are building market rate, if they can see that they can build more permanent supportive housing, that can increase and reduce their timelines. It helps them on a project. We want to look at city-owned properties. One of the issues the city has with city-owned land is that it's not utilized as effectively as it can be. And we have a lot of competing uses. We have city yards, city shops, existing facilities like parks and libraries, half-built vacant parcels, strange parcels by freeways or remnant areas, as well as some vacant lands. So how do we better use them to prioritize housing? And looking at that in the context of all of these other things. So the council member's motion essentially says, city departments, go back and look at what we can prioritize for housing. And don't look at what it could be down the years, look at what legally it can be or can't be based upon the funding sources, et cetera. And at the same time, if it has to be something else, report what that has to be so we can get a better understanding. And the streamlined permitting, I want to mention, we introduced that with Councilmember Rodriguez, as well as Councilmember Price in Blumenfield. So the council member really sees this as a partnership between him and his colleagues. Redefining requirements for temporary shelter. As many people have seen in the LA Times, the cost of building some temporary shelters has been up to $130,000 a unit. And the higher the cost of the temporary unit, the closer you can get to a permanent housing solution, right? So it's finding that sweet spot of what is a good cost for a temporary unit so that we are not dramatically affecting our long-term supply of permanent supportive housing. So one of the ways to do that is looking at our requirements. The city has many fire codes and building codes, which are designed for permanent facilities, things that are going to be there for 10, 20, 30, 100 years, right? Temporary shelters is by the very nature temporary. And when you're designing it to the same code requirements for things that aren't necessarily all about life and safety, you really drive up project costs. Expansion of Project Home Key, and that really looks at leasing to own. How we look at, if it costs $8 million to buy a hotel, do we lease it for a few years and then have the ability to purchase it with the right of first refusal in 3 to 4 years at a set price so we can house more people now? Then the couple of the others that haven't, we're getting scheduled for committee, evaluating our HHH projects, seeing where they are, seeing which ones are doing well on their timelines and costs, and other ones that are a little behind and what we can do about those projects, as well as looking at what the city's legal ability is for HHH funding. Ones where the city can, if a project is dramatically far behind and is costing $600,000 or $700,000 a unit, if there's other ways to, if you can make that $350,000 a unit, you might not save all the HHH funds, but you might save other funding sources, such as state funds, et cetera. And then, as I said, the permanent renter aid registry system, which has been adopted by council. So those are our motions. You can go to awayhomelOsAngeles.com, which essentially provides more updates about our program. You can sign up to support it, learn more information. I want to stress that the 25,000 by 25,000 is a goal. If we don't establish a goal, we don't get there. As you all know, the city is in the LA Alliance lawsuit, and part of the agreement with the county last year was to fund 6,700 beds, or to build and fund 6,700 beds by, I think, this coming December, with the majority of which have to be done by this April. That deadline of just the 6,700 has mobilized the city immensely to build an insane amount of units. Now, Not all of them are permanent housing. Many of them are temporary units. But just by having that goal has spurred and created one vision that the whole city of Los Angeles can go to. And that's why it's critical to have a larger goal. Because once we house 6,700 people, there are still over 30,000 people still on the street, right? So we need to have a plan that really addresses those in a long term, right? Are we building 5,000 next year and 8,000 the year after, or however that breaks down? And really starting to think about how we can, help end homelessness as much as possible. But as much as we build, we have to address our inflow. Because the larger our inflow gets, we're just going to be digging out of quicksand, and it's going to get worse and worse. So that's all I have. I don't know how much time we have for questions, but willing to answer anything. We can always have follow-ups if you all have more detailed questions. So thank you.
Thank you so much, Nate. There's so much going on. I did have one quick follow-up question myself, and then of course I'll invite our audience to ask their questions. How long did it take to bring those 6,700 units online?
So the agreement was signed June of 2020. We have to, and 700, so there's 6,700 beds. 700 of those were already in a partnership between the county and the city. So 700 counted towards that. 6,000, including that 700, if that makes sense. 6,000, including and that includes the 700 in the previous agreement. So 5,300 new ones on top of that have to be done by April 16th of this year. The rest of the 700 have to be done by December. So if you look at that, that is 10 months from June to April to put on 6,000 beds. Now we've been very lucky that we've had support from the state in the Home Key program. With the first round the governor released, we actually bought 2 motels in El Sereno for that, that we're going to be looking to target housing El Sereno homeless for that, which was, I think, over 100 beds. But it also has involved temporary shelters. The council members proposed a few, which we definitely do not see as the final end game. But what that will do is at least get us partially there.
Thank you. We have a question in the chat from Priscilla. She's asking, Priscilla, would you like to ask the question yourself?
Oh, sure. I just wanted to ask if there's going to be like a limit of how many people can apply or how many people you can take in. I know that there's already a minimum amount of units. But once they're all kind of finalized, what would be your limit? What would be your criteria, as well as who would be eligible for these units, and if there will be family units as well? Because, as much as there's individual homeless or people going through homelessness, there were a lot of people that were affected since 2001, and so I have yet to hear any initiative for family units.
And thank you. That's a really good point. And 25,000, to clarify, also includes family units as well. We understand that there are thousands of people who are part of families living on the streets. And just putting 4 people in a single family studio is not going to make it very comfortable for the people in that family. Everyone's going to be fighting over the sink, or arguing in the shower in the morning about who gets to brush their teeth or whatever, with kids going around, as I have to deal with mine. So we definitely see housing, family housing, as a part of that. I think the key is really figuring out a breakdown, right? We're very lucky that the annual homeless count, which has happened every year except for this past year because of COVID, or this year because of COVID, breaks down the family units versus transitional age youth versus people who are single adults, which helps, you're going to use to help guide our proportions for what needs to be produced as part of this 25,000. So we really work with LAHSA and the county and the coordinated entry system, which is how a lot of the permanent housing gets. The temporary housing is a little bit different, where there's some geographic, based upon where the temporary homes are. For example, the units in El Sereno, because we obviously bought 2 motels literally right in El Sereno, we want to obviously prioritize the individuals in El Sereno. Not that we're not thinking about everybody else, but prioritization is going to be very site-based, however, with the overall goal in mind. Yes, Heather, you can say who's next.
Yes, we have a wonderful quote comment here from Barbara Capos. Barbara, do you want me to take this away, or would you like to make your comment aloud?
Well, I basically thought this was an opportunity to bring up this issue. I did actually contact your office in regards to Project Safe Haven, which is a collaboration of several nonprofit organizations providing housing or shelter for families impacted by domestic violence. And the program was going to go until end of April, and it was abruptly ended last week. And this, created a huge impact for the organizations or the families we're working with to place them within 1 week. We were at a hotel downtown, and several other agencies also were located at different hotels throughout Los Angeles. And I just needed to really, build awareness around families impacted by domestic violence and how this program was supportive of those families finding shelter. And then we worked at finding a more permanent solution for them, but to abruptly end it within a week, and agencies to try to find placements. We're paying for these families at different hotels now. I just think it's essential that this situation, and I don't mean to target this conversation, but it was important that everyone knows that this is happening, and it's unfair. And many families that are faced with homelessness and domestic violence are not always given priority. And this program, unfortunately, should not have been abruptly ended like that.
Okay, was this a part of Project Roomkey?
Well, it's not part of Project Roomkey. It was separate.
Okay.
And I think the two always get confusing, but no, it's Project Safe Haven. It started out as through the foundation, through the mayor's foundation, and then it moved into the CARES money and whatever. And it was supposed to end at the end of April. So, but we were told just a week prior to, that the program would end. And that's leaving, many, many families in a dire situation.
Yeah, if you could just send me an email on that, I'll put my email in the chat. We can have a follow-up conversation about that, obviously.
I appreciate that. Thank you.
How do I do this? Chat, okay.
Do we have other questions for Nate?
See a couple of hands raised.
Is it okay? It's Monica. So I have a.
Please go for it, Monica.
So I have a couple of things I really want to acknowledge and just say that I'm really proud and very excited that Kevin is doing everything that he is doing. I see him doing things like really outside the box. I'm excited about the temporary housing that he's proposing in Highland Park and in El Sereno, because we know, or I know, or a lot of people know that services and that type of housing and shelters are not readily available in the Northeast. So that I'm really proud of. So there's two things that I'm concerned about. One, about, having a standard kind of building process, which I think is a good idea, but I think that it's important to also look at the community and make sure that the size of the buildings fit into the community. As you know, I live in Highland Park, and the look of the community is really important. It's a historic community, so making sure that things fit is important. And then the other thing is that I'm concerned about people playing a certain game and getting over, as real estate investors have done, to manipulate the system and get something out of it that's really not going to benefit the community. And then the last thing is that while building new homes is important, I think if the council member can really look at, the cause, and we know that people that buy buildings have been able to double the rent and, kick people out. And that's one of the big reasons why we're in this mess. And I've said this for years. And I know that things have people have tried to look at that or have not really looked at that, because you have to stop, you're talking about the whole, and we're just going to keep building that whole if people are able to have, rent a 2-unit building for $3,000. Like who can afford that, right? You have kids that are coming out of college that there are 6 of them in a unit, and they're all paying $800 or $1,000 to be able to afford that. So I think we have to look at that other part as well. Because I will say this, that we're not in a housing crisis, we're in an affordable housing crisis. So let's push the council member. I think he would be open to that. And I think this is the time to do it. But again, I think like he's doing a lot of good stuff. I'm very appreciative of the fact that he wants to build things in Highland Park and in Northeast, because we desperately need this stuff.
Thank you, Monica. So you bring up 2 points. The first one I'm going to address around is sort of the scale of housing. So, if you look at, there's a city system called ZEMAS, right, which is the zoning system, and you go on there and it starts you with a view of the city, right, and you zoom in a little bit and it shows different colors for the types of land use, and yellow is single family zoning, tan is actually multifamily. And you'll see how housing is distributed in the city. And it's very clearly an income and an equity issue, where areas that are more well-to-do have more single-family homes. And one of the issues that it comes down to is, there's a lot of pushback in those communities for building affordable housing. But the scale of the housing, regardless of the neighborhood you build it in, is very important, right? When you have a 5,000-6,000 square foot single family lot, you're not going to be able to build, even if the community wanted it, right, a 4-story building, 5-6-story building. You physically can't do it, and it's going to be very expensive, and you're not going to be able to get the unit, the ideal units you want on there. So one thing, and that's why the council members' standard plan looks at more than just multifamily. It looks at accessory dwelling units as well as bungalow courts. And one of the things we're doing, the council members' motion actually just passed council this week, is looking at the 710 properties. Caltrans owns a substantial amount of parcels that are vacant, both single vacant homes as well as vacant land. So what we're doing is we're working very closely with the community to figure out what land uses make sense on each vacant parcel, to figure out how we can look at adding affordability, but also in context to the neighborhood, right? It's a single family neighborhood for the most part, right? We're not going to be building apartment complexes, because even if the city wanted to, it can't, right? So I think context is very important, and looking at the neighborhood context, but also with the goal of the affordable housing. The second thing on the speculation developers, you're absolutely right. Highland Park in itself has skyrocketed. I remember when I lived in Highland Park 8 years ago, or no, when I started renting in Highland Park 12 years ago, I think I paid, it's like $750 for a 1-bedroom, and I was under rent control. Now I think it goes for like $2,000 to $3,000, and a lot of that is because the market has had the ability to drive up costs, right? Because there hasn't been the production we need of affordable housing. So I think that that's something it's a really big issue, and I think there's a lot to work with there, and we really have to think about all the various stakeholders. For people who build market rate, or who are in that career, I'm not saying that's bad, but I think part of the issue is frankly, if we don't address our homelessness crisis, people, look at downtown. There's major issues, and you have people complaining about the homelessness crisis. Well, if you don't build the housing for people, where are they going to go, right? It's just common math problem. And you can build all that market rate housing you want, but you can't just say, sweep all the homeless away so I can live in my ivory tower. So I think that's something we definitely have to work with all different constituencies on, from market rate to community groups, et cetera. It's in everybody's best interest to address our homelessness crisis and to build that affordable housing. Right, next question. I don't want to dominate your guys' agenda too.
Yeah,
so.
we could say we have 2 more questions, and then as we are running a little short on time, I'm going to ask Ozzy and then Juana to ask their questions, and then we'll be moving on to our next presentation. But Ozzy, go ahead.
Awesome. Nate, good presentation. It's good to see you. I want to applaud first and foremost the council member and the council office because you're addressing a humanitarian issue, really in the city of LA. And this 25 by 25, it is a citywide issue that is extremely important that it be addressed. But to go back to the beginning of your presentation where you indicated that CD14 is the epicenter, right, of the homeless crisis. What is the approach for the district to address this? Because building the homes is one element of it, but from a social determinants of health, right? How are we also going to work on increasing supportive services, right? Providing additional supportive services in the areas of substance abuse, health and wellness, access to food, access to good quality education, because all of these things factor into the impact that many in the district are facing when they're dealing with homelessness. I'd like to hear a little bit more about that, especially for CD14, because as you indicated, it is the epicenter. So does that have a sense of prioritization when it comes to the 25 by 25?
Thank you, Ozzy. That's a really good point. And I think one of the things that we have, I think, with the homelessness crisis is when something becomes so big of a problem, it almost becomes overwhelming, right? And the critical way to addressing an overwhelming problem or that might seem overwhelming, is to break it into chunks, right? Figuring out how we build our units, and that's that bucket. And then how we're addressing our inflow, right, with production. And then how we're addressing issues such as the service providers and, the interventions, the barrio actions of the world, the organizations that are helping with, getting people on their feet. And I think that we see these as buckets. One of the things the council member co-introduced, with Councilwoman Rodriguez, has been looking at a youth development department and how we in the city really improve our youth development across the city. We have so many nonprofits doing so many amazing things, but a lot of people are operating on shoestring budgets. And frankly, most are probably operating on shoestring budgets, trying to figure out where the next grant's going to be, trying to figure out how they're able to engage youth. How are we able to work together better as a city to coordinate and really help the service providers and set up that system where it's not this constant scramble and it's always pushed to the back burner? So youth, I think, is one component. Obviously, there's families, et cetera. The city invests in family source centers and all these things, but how are we coordinating all of it? How are we making sure that money we're putting in any given spot is going to the actual larger goal, right? So it's breaking things down into chunks and creating pathways to addressing each of them. So I think this is definitely addressing a lot of this is obviously addressing our housing production and unit crisis. With, we also have the rental registry, and I want to, mention, just because we said, okay, we're doing 9 motions is not the solution. We definitely see partnerships on other policies, and we're obviously looking for creative ideas people have. The council member is very big on working with his colleagues. Almost all those motions were introduced with multiple council members because the only way we're going to address this as a citywide issue, and that means, someone in Northridge or San Pedro or Venice or Boyle Heights or wherever it is, different communities have different geographies, different layouts, et cetera, but homelessness is a citywide crisis. So we have to figure out how we're working together, and that's why the council member is really working with his colleagues on the phone constantly with them. I see him calling, hey, what do you think of this idea, et cetera. I mean, there's a lot of thought that goes into it. Our goal is not to introduce policy for a press release and it to go away. That is maybe great for one day and it goes on social media, but that doesn't address our crisis. And that's not actually going to get us out of where we need to be. And that's why we really see this. This is a marathon, but the marathon needs to happen at a sprinter's pace, right? It's not a sprint for 1 year, build 6,700, done. No, it is how are we doing that sprint pace to hit 25,000 units and to build all these supportive services around it we've talked about.
Fantastic. Thank you so much, Nate. What a wonderful, wonderful presentation. Juana, would you like
quick on my response?
We have one more question. Juana Mena, would you like to close us out on this particular topic?
Gracias. Mi nombre es Juana Mena. Quiero agradecer al concejal de León por el trabajo que está haciendo, pero ahorita mi mayor preocupación es durante este tiempo de pandemia, y con los nuevos brotes que están saliendo, las personas que están todavía sin hogar, ¿qué está pasando? Porque esto es, para mí es muy preocupante, principalmente que yo vivo cerca al Sereno y cuando veo todas esas áreas, principalmente la calle Huntington Drive, cómo está, me preocupa. Entonces, esto va a generar como una fuente más para que se propague más el COVID o las nuevas cepas que están saliendo.
Thanks. My Spanish should be better, according to my mother-in-law, but I don't know if someone wants to translate that, so I should know better.
Sure thing, Nate. Juana's comment was largely related to the co-situation of COVID and the homeless situation. So the unhoused that are in her community and how the COVID pandemic is impacting them and how that is an additional cause for concern in these public health conditions. So I think it's kind of that intersection of public health and homelessness and kind of how that's being addressed.
Great, thank you. And I'll be brief. COVID has been a massive impact on Boyle Heights, particularly and the east side. If you go on the county website, county's done a great job of showing like all the breakdowns of COVID by neighborhood, cities, unincorporated.
And let me tell you, Nate, you are like leading into our next presentation where the Office of Supervisor Solis is going to be talking a lot about that.
Okay, great.
Great tie-in, great tie-in.
Right. So on that, you can look and see Boyle Heights has been hit very hard. The council member has been working closely to basically have mobile vaccines distribution on the east side. So we're obviously targeting our homeless population with that, and areas that have less vaccine response rates. So if you're interested in the vaccine issue with homelessness, you can shoot us an email. In the intersection of homelessness, one thing we're obviously very worried about what happens when the rental moratorium or the moratorium on paying rent or whatever expires. That's a huge issue that is coming down the pipe. We could have, frankly, thousands and tens of thousands of homeless families because they haven't been able to pay $2,000 rent because they haven't had a job. So I think that that's something that we're really concerned about and trying to figure out the best policy solutions to that. So.
Thank you again so much. Obviously, we really appreciated the presentation. It's so much great information, and we are just very grateful for your time and your colleagues, Sarah and I'm sorry, Sarah and Lucy, thank you. Sorry, thank you so much, Sarah and Lucy. My apologies on having a little brain skip on your name. And I'm very excited that this is the launch of this relationship between the Health Innovation Community Partnership and your office. We're delighted to have any of you join us anytime. And of course, please always reach out to me if you have a particular presentation or update you'd like to provide to this group. We meet the first Friday of every month, and we look forward to your continued participation. With that, we'll say goodbye to Nate, Lucy, and Sarah. And we're going to turn over to Anthony and Elise, who are going to share with us some of what's been going on, as was previewed by Nate and Juana, some of what's going on related to the COVID pandemic within the communities represented by Supervisor Hilda Solis. Anthony and Elise.
Great. Thanks so much, Heather. And thank you all for inviting us back today. We love this meeting. Anthony's on, but for whatever reason, his name says Wakas, and I realize my name said Wakas, but Anthony, if you could change that so people know who you are, that would be helpful.
Will do.
Good morning, everyone, again. So we here, Supervisor asked us to join the meeting and share an update because although we recently participated, so much has happened since then. Some of it good, but first we just wanted to start with a little bit of a presentation. I think much of what we're going to show on the slides before you is nothing new to you. I think everyone here is very understands the inequities that the cities and areas in the first district have faced since the beginning of the pandemic. But we do just want to give you a sense of sort of the cases and the corresponding vaccine rate by area. So if we could go to the next slide, please. Great, so this just shows a bit, it's a little hard to see. We could send this out afterwards. I apologize for that, but big props to our team for putting this together. So what you could see is on the left-hand column, it shows the total cases by, I don't know what happened. No worries. Total cases by city. You could see that a lot of our cities have a significant number of cases, although East LA isn't reflected on this slide. Neither is Boyle Heights. I think everyone here knows that those areas in particular have just been devastated. The total cases per 100,000 is a really important figure because it allows us to compare how cities and communities are faring with respect to other areas or the countywide average. Again, not to go through all these numbers, but the cities in the first district, the communities in the first district have much higher case rates compared to the countywide average, as well as compared to other supervisorial districts. The same is true for the deaths and the death rates. The first district and individual cities within have just had significant death rates, although thankfully we're starting to see those decline. I think everyone here knows that unfortunately there's just been so much grief and tragedy in our communities. And sadly, and I think as a lot of us have been working to try to preclude, the vaccine rollout in the beginning has been inequitable, which the supervisor is obviously not pleased about, and I know her constituents aren't as well. So the total vaccines you could see in that column talks about the vaccines by city and the percentage of those eligible who are 65 and older who have received the vaccines. You could tell that some cities have received a lot more of their residents 65 and older have received the vaccine compared with others. I believe these figures are from mid-February or so. So we hope to have updated figures today or early next week. I think we will see a lot of improvements in terms of the equity piece, but we just wanted to get this all on paper so you could sort of see the comparison, because obviously the inequities unfortunately have transpired throughout the pandemic. Next slide, please. Again, not to be repetitive, but this just goes into more detail about the total cases by city and per case rate. Next slide, please. Same thing. Next slide. We could keep going. This may be it. So this is just more detail about, you could see it a little bit larger. We're happy to pull the numbers for other areas that aren't reflected on this slide if anyone is interested in knowing for your specific community. Anthony, do you have anything to add with respect to this data?
I think to kind of underline the point that Elise was making, it's hard to see compared to other areas, especially more affluent areas in the county, what these numbers are in comparison. These are the SD1 rates, which is hovering around like the low 30s to low 40%. When you look at some of the more affluent areas in the county, we are seeing some vaccination rates upwards of 60%. So that's kind of the disparity we've been looking at here, about a 20% disparity, which, as Elise said, we're hopeful that recent efforts in the last couple of weeks have addressed, and as soon as we get that updated data, we'll have a better understanding.
Yeah, and I think just so everyone knows, I mean, some of the figures the supervisor has really been harping on, the case rate in East LA, for example, like 20% of the population has been infected with COVID, but only 9% have actually received the vaccine. And so that's an issue that we're trying to address. The same is true with Southeast LA, where several cities like Cudahy and Bell are below 40% of those 65 and older have received the vaccine, which is just really startling. So the supervisor's working to address that, and that's what we really wanted to focus on today, because you all are part of the solution. I think in going with some exciting news first, the supervisor partnered with St. John's Well Child and Family Center and SEIU 721 this past Wednesday to open up a vaccination site at the East LA Civic Center. That is a site intended for community. In fact, I know many people are trying to find it on the state system to make a vaccine appointment called My Turn. You will not find it there, and that's really intentional because unfortunately that website has so many holes in it, and it just does not guarantee that people who, a vaccine site is intended for get the vaccine. So the reason for that, so that's the reason for that. St. John's Well Child is setting up a call center that goes live today, and we're happy to share that phone number with everyone afterwards. Fully staffed with 25 plus people to make sure that that site serves the community it's intended for, which includes East LA and the surrounding communities. So that's a really exciting site that we have, where the supervisor did a lot of work to get that up and running. They are going to vaccinate between 400 to 600 people a day. They're open Tuesdays through Saturday. So it's starting with about 2,000 vaccines a week. And we're really excited about that partnership and happy to offer a tour to anyone who wants to go see it in action, because it's really a beacon of hope for sure. So that's obviously only one part of the solution. I think the supervisor has been very clear that just because there's a vaccination site within a community that's been devastated, that alone does not make it there for community. She saw, for example, when she partnered with the state and the federal government, they deployed a vaccination site to Ramona Gardens, which I'm sure many of you are familiar with, in Boyle Heights. Very few people who live there actually received the vaccine with this mobile clinic. Instead, people were traveling from the west side and other parts of the county to get the vaccine. We had a bit of a stern talk with our partners at the state after this, and they have addressed or have recognized the concerns and have really improved how the mobile clinics are rolled out. I think a really good example of that is Alma Family Services, where one of the mobile clinics is currently in East LA at their Centro Estrella location. Alma Family Services, I don't know if they're with us today, but they just did God's work, truly. They were hitting grocery stores, restaurants all weekend to register people in person. That's what this requires. I think the supervisor was very intentional in telling the state that you need to partner with Alma Family Services and other CBOs, because they know what it takes to reach community. And I'm really pleased to tell you that Alma Family Services not only filled all of the 250 plus appointments for the day, but I could assure you that the majority of those appointments were members of the community that would not have gotten vaccinated otherwise. So just wanted to share that good piece of news. Also, the supervisor is in Southgate today, where she is launching another mobile clinic at Southgate Park in partnership with the state and the federal government. This was a result of the supervisor's letter to the state and the federal government last week, where she requested a dedicated mobile vaccination clinic for Southeast LA. Because unfortunately, I think some of you may know, Southeast LA doesn't have large pieces of property where we could launch a mega site like Cal State LA, et cetera. So mobile clinics are very much a part of the solution. And the supervisor, just given the really low vaccine rates in those areas, the supervisor sent a letter asking for a dedicated mobile clinic. And so great news to share that because of that letter, they actually deployed a third mobile clinic, as if they only had two until today. And that's going to be in the Southeast through next Wednesday. And we're eager to see it stay in Southeast LA. I've been talking for a bit. I just want to touch on a couple other things. So in addition to the federal and state mobile clinic, our county Department of Public Health also has its own mobile clinics in partnership with the organization called Curative, as well as other organizations. And we have those mobile units are really focused right now on going to senior housing sites throughout the county. Many of these sites have so far included senior housing developments in the 1st District. It was at Nueva Maravilla this past weekend. It's been in La Puente. It's been in Pico Rivera, Bell. It's going to people where they live to make sure they get vaccinated. And so it's going to about 28, maybe more sites a week. And the supervisor's advocating to make sure those sites go again to the communities hardest hit. The benefit of that partnership is that people don't have to register in advance to get the vaccine. That's a barrier. The good news about having it offered where people live is that they could register that same day. And so that's definitely going to be a significant part of the solution moving forward, is bringing the vaccine to people. And with the announcement of Johnson & Johnson getting the emergency use authorization, I think we could expect more mobile units to be deployed because it's much easier to do that once we have a 1-dose vaccine, as opposed to having to go back out after 3-4 weeks, right, to get people their second dose. It's easier for people who may have trouble, you know, getting down the stairs or et cetera, or getting to a vaccine site. So those are some of the efforts. And then I'd like to just preview, this is embargoed, but the supervisor is putting forward a board motion on Tuesday, directing county departments to explore making some of the vaccination sites 24/7. As we start to see more doses come into the county, and as we start to vaccinate working people, working residents who work at grocery stores, work in the childcare sector, we cannot have these hours that we have right now for our vaccination sites. I think that, you know, the mega pods, like the Pomona Fairplex, et cetera, they currently operate from about 9:30 to 4:30. Thankfully, a lot of employers I know are paying their workers to go get vaccinated, so they're on the clock. However, that's not true for everyone. And so the supervisor is asking our county departments to assess the infrastructure that we would need to put into place so that when we do have more doses, we can have that there. You know, we need to start thinking about expanding hours. So that's all I have to say. Anthony, I don't know if you have anything to add.
I think that was quite comprehensive. I'm happy to also help answer any questions that you all receive.
Great. Yeah, so Heather, I think we're good. Thank you everyone again for the opportunity to speak.
Oh my goodness, thank you for so much exciting news. I know so many things are still being worked out and sorted out, but I definitely wanted to recognize Rem Nunez, who's here representing Alma Family Services. He put in the chat an update of their successes over this last week. Definitely big props out to you, Rem. Do you want to make a quick comment?
Yeah. Thank you, Elise, for the recognition. That when we found out, we sent staff out on a Sunday, calling folks on Sunday to go to the local markets, the local restaurants, and by the end of Monday, we had all 1,250 slots full, and literally, restaurants, local mom and pop markets were, closing down for about an hour or two to get all their staff to come and get vaccinated. And it was powerful to see senores and senoras hugging each other. People were emotional getting the vaccine because they didn't anticipate that this opportunity would be granted. And in fact, some folks thought that it was maybe a joke or whatnot, but they saw that we were bringing people in and we did it in a very orderly fashion. And so I kudos to the team, to our community ambassadors. And Diego's out there right now. He can't join us today, but yeah, it's been a lot of hard work, but a lot of good work. So we hope to continue in just supporting the community in general.
Thank you so much, Rem. And I wanted to mention also that the El Sereno Recreation Center has been deployed as a vaccine clinic site in the local area through DPH, and the CHW Outreach Initiative has been involved in trying to get people registered for those vaccination spots. So just to let everyone know, the Wellness Center is one of those partners. And so if you have people that need to get registered for the vaccine and El Sereno, there's going to be a vaccine clinic on Tuesday for first doses of the Pfizer vaccine. So we will be reaching out to the partners to help register people for that. So once again, so exciting to hear about the advent of more mobile clinics, more reaching people where they're at, more on-site registrations, and ultimately 24/7 clinics. I mean, all of these things are what it's going to take to get this massive task accomplished. Do we have some quick questions from anyone in the HICP membership?
I see a question, Heather, from Priscilla.
Great.
I could read it if that works.
Oh, yes, perfect. That'd be terrific. Thank you.
So Priscilla is asking, is there any social platforms to help spread the word? I didn't see any of this featured or promoted in the Southgate Instagram stories or posts. So, go ahead.
I would just speak briefly on the Alma Family Services piece.
Sure.
We intentionally asked people not to post it on social media because we wanted to target specific folks, right? Folks that had issues with internet access. We did reach out to our school-based partners, folks from Roosevelt High School, Garfield High School, and some of our local educators, but we explicitly asked them not to post because we really wanted to focus on folks that didn't have internet access. We know and we hope there'll be opportunities for them later, but this was a targeted effort.
Yes, yeah, the same is true of the Southgate site. Unfortunately, social media has been a bit of a problem with respect to this vaccine rollout. I think everyone probably saw the LA Times article about the codes that were sort of going through communities. And so, you know, we were trying to be very intentional. And although it's a little more work on our partners like Alma Family Services, you know, by not sharing it widely, it is, or sharing it in ways other than social media, I should say, like going to restaurants, grocery stores, being out in the community, we could better ensure that people that are intended to get vaccinated do get vaccinated. I see a question from Robert. Are folks in education fields eligible for Alma vaccinations? What documentation do they need to bring? Happy to take a first stab. So I'm not sure if Alma has any more appointments left, unfortunately. Today's the last day of it being at the Central Estrella site. It was there Monday through Friday. We wish we could get it to stay there, but unfortunately it moves around, I guess, hence the mobile clinic. But in terms of documentation, so it's an important question. So I want to be very clear that you do not need a government ID in order to get a vaccine. However, as of right now, you do need to bring some sort of photo ID so people could verify that it's you who's getting the vaccine. In terms of documentation, there is specific documentation that people need to bring now that we're doing this by sector, right? So food workers, emergency service workers, educators, school staff, childcare workers are all currently eligible, but they do need to bring some form of documentation to prove their eligibility. That could be several different things. It could be a letter from one's employer showing that you work there, right? If you're a school employee, it could be a letter. It could be a pay stub. There's many options, and I encourage everyone to go to vaccinatelacounty.com and look at the many examples of documentation people could bring to get vaccinated. We are happy to help address questions. We know it's super confusing. I also want to just confirm for this group, because I know we've gotten a couple of questions, but the supervisor was able to confirm and ensure that street vendors are eligible for the vaccine right now by virtue of being food workers. So I do just want to share that because I do think it's very, very important.
Absolutely. I think we have one final question for you, Elise. Christina Burgos asked, the mobile clinics are vaccinating people on site, or are they just there to register for them for an appointment?
Super good question. So they're vaccinating people on site. So they'll register them that day and vaccinate them that day.
Perfect. That's so wonderful. And we have a comment from Juana, who lives in Ramona Gardens, expressing her gratitude to Supervisor Solis for helping bring the mobile clinic to her site and saying that she saw a lot of people from the community getting vaccinated during that drive. So thank you so much for the presentation. I know that this will be an evolving conversation. I can imagine you guys will be back every single month but in 1 month, things change so quickly. We know in 1 week, things change so quickly. And this is nearly the start of something large to come. I know that We have a long way to go in LA County to get everyone vaccinated, and it's going to be progressive, but it's really impressive to see how quickly things are moving and changing. And congratulations again to Alma in 1 week to turn around nearly 1,500 vaccinations to targeted community members is really an impressive feat. And I know all of this is made possible through the collaborative support of the supervisor, her team, and her office, and the city and the Department of Public Health and all of our county allies in this work. So thank you so much, Elise. Thank you, Anthony, for your time with us today.
Thank you, as always. Good to see so many familiar faces. Teresa, my old office buddy, and others. Thank you all so much for the opportunity to speak with you all.
Terrific. Okay, so we now next have a long-awaited presentation and update from our colleagues over at Cosmont Companies about the Opportunity Zones policy. This is obviously deeply connected to what's been going on, because it's very imperative that not only do we get everyone vaccinated, but one of the outcomes of that is bringing the economy of Los Angeles back, back to full life. So please tell us more about the Opportunity Zones and what's happening there, Felicia. Welcome.
Thank you. Can you hear me okay?
Mm-hmm.
Okay, perfect. Thank you, everyone. It's great to be here. I know we're running a little bit late, so I'm going to focus on just the highlights here for this presentation. But we did, just a reminder of where we are. My name is Felicia Williams from Cosmont Companies. I have my colleagues Joe and Robert are on the line there, happy to answer federal legislation questions. But 1 year ago, we came to the HICP and we talked about a project we're working on with Los Angeles County. And this came up just a few presentations ago about developers coming in and creating projects that are not beneficial for the community or cause things like gentrification. So this is really a policy to try to guide investments that come into the community towards things that are beneficial to the community. So LA County is working on that. We were hired to work on that with them. Last year, we started off a community process. We had to delay that, change it a little bit, but we still got some feedback. And so we wanted to review that feedback with you here. It's a pretty deep presentation. It's in draft form right now. But if there are more detailed comments or feedback, we're happy to schedule a meeting with the HICP subcommittee that's looking at opportunity zones. Or if maybe people can send feedback to Heather and Rosa after this presentation, we're happy to receive that as well. So if we could go to the next slide. So just a reminder, what this is this is a federal piece of legislation that was passed in 2017 called Opportunity Zones. Our goal was to gather community input and mostly centered around the General Hospital feasibility study. That is one of the biggest opportunity zones in LA County and the biggest county-owned project in an opportunity zone. So that's why we focused here. That's why we're meeting with the HICP. This is a proactive process to try to help guide whatever investments come into the community towards community benefits and to help address issues like displacement and gentrification. It's a brand new policy. We have case studies from different cities and states about what they're doing, but I think this will be one of the first counties to have its own policy. And of course, we're coordinating with different parts of different departments within the county and the city. As you know, General Hospital is located in the city of Los Angeles. So we are coordinating with them as well. Slide. So just a reminder of what the opportunity zones are. It was passed through the Tax Cuts and Job Act of 2017, and it provides a tax break for capital gains that are invested in opportunity zones. So those opportunity zones were set by the governors of each state based on feedback from local jurisdictions. And the investments can be made in either projects, like real estate projects, housing projects, or in businesses, which is very important in opportunity zones. Where we are now is there are 17 opportunity zones in LA County. They are all in the 1st and 2nd district. The 1st district has 4 opportunity zones. And so we are focusing on the opportunity zone around General Hospital. So next slide. this is the good news. We always like to have good news. I've heard so much good news about vaccines and other things and solving homelessness on this call. So hopefully this will be some other good news. But what we heard from the community, they also heard at the federal level. So we have a new administration, which is great news, but they all feedback and about community benefits, about transparency with opportunity zones. So we believe that the Biden administration is focused on amending opportunity zones to hopefully address some of the same concerns that we heard in the community. So those amendments would be community engagement and benefits, and evaluating the program impact. How have they made changes in jobs or the environment? What are the benefits they're providing? Giving more transparency to opportunity zones. What are they investing in? How is the community involved? And then also some other general changes to help sort of combine opportunity zones with other programs. And really importantly, one thing we heard in the community is, can we change the opportunity zones? So there may be an opportunity to change the actual census tracts that were designated. So I think that's good news. So we'll go to the next slide. So this is just our project timeline. We put some of it on hold because of COVID-19. We couldn't meet in person. So those are the 5 stakeholder engagement workshops. We hope to do that at a later time. So we'll get back to if we have that. What we did do is we went and we met with community organizations like the HICP and then other nonprofits in the community that could be guides and partners for opportunity zone investment. And you'll see down there in the table, we have the time there. But if you look at the summer and fall, the different groups that we met with, last February, we met with the OC subcommittee of the HICP, which provided really, really good feedback. So those are the So this is really our summary so far of what we've heard. And I'm going to spend the rest of the time on this slide and not go into the details of the policy, which are more technical on the next slide. But this is generally what we heard, and this is what I would like to get feedback from the community on, that we heard the right thing, and are there areas of this that we should expand. So the first theme that we heard was that county opportunity zone projects should provide some sort of community benefits. So the first step is to identify what are considered community benefits. What we heard from the community through the General Hospital study and other community meetings was that there's some priorities. Affordable housing was one of them, jobs and workforce development. And then a really big theme that came up is there are a lot of small businesses that contribute to the culture and the fabric of the community. They are locally owned and they employ locally. How can we get them investment if they need funds to expand or to stay open, especially because of COVID? So trying to guide opportunities on investment to those businesses was piece of feedback that we heard from the community. Other priorities, open space. And then another one, community ownership models, community land trusts, equity owned or employee owned businesses. These were some other ideas that came up that we could try to drive investment towards. So the first question is, what should opportunity zone projects produce in terms of community benefits? The theme that we heard was, how do we apply policies then to these projects to make sure that they do derive community benefits? There are a lot of existing county policies that are already being formed or have been formed. Those are listed below. Community benefits policy, inclusionary housing. How do we expand those and include opportunity zones in those so that there is a county policy guiding these? The additional things that we want to include in an OZ policy that we heard from the community is anti-displacement and tenant rights. How do we incorporate that? Is that a land use overlay? How is that done? And how can we use existing and future county policies to cover that? How do we incorporate community outreach so that the community is involved in determining what these, and then how do we report back to the community, have transparency, and have the community involved going forward. And then one really big beginning, the county owns a hospital, but what a project down the street that's privately owned. There may not be any feedback on that, and there may not be any community involvement in that. How can we get the county to be involved in that private project and help out in terms of community feedback and guiding that towards community benefits? And so that brings us to the last theme that we had, which is a county role. And throughout all of our meetings, what we heard was that the county should be proactive. The county should not be passive and just have a website that people can look at. The county needs to be proactive and involved in those projects, whether they are private or they are public county projects. We need to find a way to have the county involved in private projects. So some of the ways to have the county involved in private projects are listed here. They could do a fund guarantee, the county could provide infrastructure improvements, but most importantly, the county should help nonprofits build capacity, because those nonprofits will be the key in terms of working with opportunity zones, understanding their communities, understanding their needs, and guiding those projects towards community benefits. So the next slide's most to do with details on how we would implement that policy, but this is really the main slide where we wanted to get feedback. Did we capture everything? Are there additional areas you want us to look at? And most importantly, how can we better build capacity with nonprofits like the HICP, like the members of the HICP, to be involved in the process and help the county guide these projects towards community benefits? So I'll leave it there. I know we have limited time, but happy to take any questions and any feedback. I do see some items in the chat, and if I was more technologically savvy, I could go between the chat and the presentation, but trying to read them at the same time, but happy to take any questions.
Yes, thank you, Felicia, and thank you to your colleagues, Joseph and Robert, who are also here with you to help answer any questions. Vivian, you have a nice long comment in the chat. Would you like to share that aloud, or would you like me to read that? Okay, I'll go ahead and read Vivian's comment for everyone. Vivian says, Felicia, thank you so much for the topic. I don't know if you are aware of Pacifica, who are the owners of Sakura Gardens. Pacifica is proposing a modernization project which was denied by our Boyle Heights Neighborhood Council and other groups through the community. Others opposing the project of displacing our Japanese elders that have been living at Sakura Gardens for many years, including council members Kevin De Leon, Hilda Solis, and others, to help people from being displaced. But that bill is going to take some time, and Pacific is working on displacing our seniors now. What can we do? What can we do? So I'm not sure if you're aware of the Sakura Gardens project and the group Pacifica that it sounds like is trying to come in and have a development that would displace that particular housing complex.
And I don't know that. So this policy will just be in federally designated opportunity zones. So if that isn't an opportunity zone, that's exactly what this policy would help address and prevent. If the county can get involved in that project and provide some other benefit, maybe the developer would look at doing something different in terms of rehabilitating the building and keeping the seniors there, which would be a much more beneficial project. So I don't know specifically about that project, but in terms of the community, I think that there are things, the community has a lot of power, and coming out and requesting community meetings from your elected officials so the developers can hear your concerns, and then also finding a way to partner. Look, if you work with us, we can help you with this, we can help you, because the last thing a developer wants is a lawsuit or some sort of appeal that delays their development and doesn't get it done. So the extent that the community is there, the community has power to say, if you bring us along and you listen to our concerns and you respond to them, then we can help you get your project through, a better project through the process. But that's a big issue that we're all dealing with in all of our communities. So it's very important for the community to get involved.
So it's a wonderful illustration of kind of what the opportunity zone may be able to improve upon. Are there other comments or questions related to the opportunity zone policy recommendations? Felicia, when is this likely to go before the Board of Supervisors?
So we are compiling all the recommendations. We will meet with the first district in the next 2 weeks, and then we would hope to get this to the County Board of Supervisors in April. So that will be the next and final step for this phase. So that's it.
Terrific. And just to let you know, we did send out a copy of the slide deck to everyone who's registered for today's meeting. We try to do that at the start of the meeting for anyone who's participating by phone. So people can certainly take a look at the slides, and if they have additional feedback, I'm confident they could get in touch with you and share that feedback directly. But before we leave this segment, does anyone have any other questions or comments?
Hi, Heather, this is Vivian. I'm sorry, I stepped away for a moment. And hello, everybody. Yes, with regards to Sakura, I think that the activism that we have here is amazing. But the problem that we are challenged with is Pacifica is privately owned, they're national, and they have pretty much denied every request to meet from our local representatives, including Hilda Solis. So we are actually stuck between a rock and a hard place, as they are now proposing to literally evict and displace our seniors and place them in other facilities that they currently have that also have a higher rate of COVID-19 cases. So we're really concerned about that, as well as these seniors who probably have signed a contract to live there. We have, again, many groups. We have groups that are looking for legal services, trying to battle with Pacifica, who is not replying to any request from our assembly members, from our county supervisor, or anyone. They are just moving forward with any concern for the elderlies that are currently living there. We've been battling with this since last year. It's been all over the news. Both Kevin De Leon and Miguel Santiago have been in the news with regards to this. There have been many protests. So I think as a community, as a neighborhood, we have really been doing our due diligence to help keep our seniors in their home. But again, we are being challenged with no reply from Pacifica. Thank you.
So one, I'm going to put my different community hat on here just as a community member. One idea is to address, I don't know if Pacifica's already bought the body or the project, but there's a new state program that encourages developers to buy projects and convert them to moderate income and keep the residents there. And they then get nonprofit status. So they get a tax exemption on the project, which they wouldn't get otherwise. So there's a new state program. I can send you a link to that, Heather, if you want to share that with people. That's one community resource. But that would be the other way to do it, is say, hey, instead of spending all your money building a new project, why don't you improve the project, keep the residents there, and we can get you funding for rehabilitation, a tax exemption, other benefits to try to keep the residents there. So that's like this community idea. So I'll send that to you.
Thank you very much. As it is, Pacifica is national, so I don't think that they are really interested in becoming a nonprofit, and they are actually wanting to go ahead and build and convert this facility into market rate apartments to bring in families. And again, this is challenging also our historic district on Boyle Avenue. Sakura Gardens is also the place where Boyle Heights was founded, with our historians from the Workman families and the Temple families and the Boyle family. So we, Boyle Heights Community Partners, has just submitted our historic preservation landmarking application to actually help to protect the koi pond. Again, this project is so large.
That's another good way to do it.
Yeah, that we're up against like King Kong. We can't get past that massive wall. They refuse to meet with anybody. It doesn't matter who you are. Again, all of our assembly members that are trying to contact Pacifica are being denied. They will not reply to any phone calls, any emails, any letters. And so right now they've already submitted a letter to all of their tenants, basically saying, prepare yourself, you're basically going to be evicted and we're going to find you someplace else to live. So again, public counsel has been contacted, And, again, we know that they probably have contracts that they've signed. So, there's some logistical issues that we're also concerned about, and how can we protect our elders that are going to be basically evicted and displaced.
Well, thank you, Vivian, so much for sharing a living example of, when the right proper protections and opportunities aren't built into the system, things can definitely go amiss. So with that, thank you so much, Felicia. Thank you, Robert and Joseph, for joining us today. Very exciting. Like I mentioned, if people didn't have time to thoroughly think this through or reflect upon your slides in your presentation today, we'll open the opportunity for them to communicate with you via email to share any feedback. As mentioned, this will be going to conversation with Supervisor Solis's office within the next couple of weeks, and then hopefully before the entire board in April. But thank you again so much for sharing with us the great work that you guys did during, once again, an unprecedented year of trying to do community engagement and getting community feedback sessions rolling during the COVID pandemic. We understand that changed a lot of plans that you had at the outset, but it sounds like you've come up with a really, a robust process and some really wonderful findings. So very exciting.
Thank you, everyone. Stay safe and stay tuned, because we'll be back.
Terrific.
Bye.
Fantastic. With that, I am going to stop my sharing and invite my colleagues Isidro Villanueva from WEDAX, as well as Ozzy Lopez, to share with us some of what's going on in workforce development. There's some exciting new updates in that area as well that we wanted to share with you at today's meeting. So with that, Isidro, please take it away.
Yes, hi, good morning, everybody. Happy Friday. Let me know if you're able to see my screen. Okay, thumbs up. Great, thank you. So I'll move through it quickly because we do have a couple of guests here presenting alongside with me. But again, this is an update on the local and targeted worker hire, specifically on the LEC USC construction projects, and then also an update on the upcoming 3rd and Dangler housing development project. So I want to give an update there. And again, I'll move through this quickly, but just a reminder for everybody that there is a subcommittee where we go into details on all of these projects and all of the reporting that I will be doing here. So if you're interested in joining that subcommittee or being part of that discussion, please email myself or Heather or Rosa so that we can get you into those meetings. But again, this is just a really quick update given the time. So just a reminder again that with the county's local and targeted worker hire policies, specifically on the local worker, there is what we call 2 tiers in order to meet the local hire requirements. Tier 1 is a 5-mile radius, and then tier 2 is qualifying zip codes within the county. However, on these LEC, USC, and 3rd and Dangler projects, there is a focus and an emphasis on kind of they're making sure that we're targeting a 2-mile radius within these projects. So thank you to Department of Public Works, who has gone ahead and kind of highlighted those zip codes that are within the 2-mile radius. Again, just to show the efforts as far as getting local workers and I guess immediate local workers or close, actual local workers onto this project. So again, moving forward, we'll be able to kind of provide more data on who these local workers are and whether or not, in fact, they are from that 2-mile radius that through the Health Innovation Community Partnership, has been agreed upon. So on the Women and Children's Hospital construction site, currently the local workers are at, or percentage goal is at a little over 65%. Again, for the county policy, the requirement is 30%. With the Health Innovation Community Partnership, there is a 50% aspirational goal that needs to be met. So on the local worker percentage on this project, obviously they're above both the required goal of 30% and obviously the aspirational goal at 50%. On the targeted workers, the county policy is targeted workers need to represent 10% of the total construction labor hours. And here you see that they're well above that at over 42% on targeted workers. Here you'll see a breakdown of those local hours on this project. And then, like I mentioned, thank you to Public Works, they've broken out also kind of what that means as far as where are the workers coming from, what tiers, like I mentioned. Tier 1 is a 5-mile radius. And then, what's the focus on the workers from the 2-mile radius, that immediate local area. And then obviously tier 2, so again, thank you to Public Works for bringing that out, because I think there's been interest in again, ensuring that we show who's being represented or who's being counted as a local worker, and whether or not, again, they fall within tier 1 and definitely tier 2. So that's the Women and Children's Hospital update there. On the restorative care village, on the local worker, they're just under 33%. Again, as far as the county policy, they're meeting that required goal. But as when we talk about the aspirational goal, you know, they're below that. So obviously there's some room there for improvement to work with the contractor and their subcontractors, again, to get hopefully more local workers onto these projects. On the targeted worker, again, the goal or the required goal is 10%. So they're well above that at over 23% on targeted workers. And again, a breakout here of, you know, how many hours per tier 1, tier 2, and then again, the emphasis on the 2-mile radius. Again, on these local workers, we're not counting actual workers, but hours worked by workers. So again, that's why you'll see a breakout by hours versus individuals, because it's California, we count the hours of local workers. And with that, so now moving forward, again, on these 2 different projects, we'll be bringing on 2 different, I guess, if you want to call them resources, 2 different entities that will really help us kind of ensure that we're meeting our local and targeted worker goals on these projects. And then again, that we're kind of tracking all relevant data to make sure that we're reporting out on kind of, you know, all of our successes, and then also identify, you know, any gaps moving forward. So we have 2 guests with us today. On the LEC USC side of the construction projects, Public Works has procured a job developer, and that is Modern Times. And they specialize in design, development, implementation, and coordination of community programs that include disadvantaged and small business programs, local targeted hire, labor compliance, and community relations programs. So I believe with us today, we have Joe Hernandez. So I don't know if Joe, if you want to introduce yourself, and if your team is here with you, introduce your team and just talk a little bit about Modern Times and kind of maybe some of the work that you'll be doing that we have to look forward to.
Sure, yeah, thank you, Isidro, and hello, everybody. So for those of you that may not have heard of Modern Times, we're a local small business based in Altadena, California. We got our start here maybe 15 years ago. And a lot of the work that we do is economic development related. We support construction projects and how those construction projects impact the communities that they are impacting. And primarily the work that we do is public relations and anything tied to economic development, so jobs and contracts and the like. So our specialty is connecting the community to folks on the project so that those individuals or businesses can access any of the opportunities. And the work that we've been engaged by the county to do to support LAC USC Medical Center is tied to the jobs program. Every project has a prime contractor and then a team of subcontractors supporting that. There are 3 projects in particular that we will be supporting to a degree, and I'll tell you how we're going to be doing that. Each prime contractor has the jobs program goals to accomplish. They are required to hire what's called a jobs coordinator, and a jobs coordinator is an entity that helps identify individuals from the community that meet some of the things that Isidro was talking about, local or disadvantaged or targeted, depending on the project. So Isidro spelled out what those requirements are. So a jobs coordinator is tied to a particular prime contractor and then the rest of that team on a particular project. And there are 3 projects in question. So there are 3 different prime contractors and therefore potentially 3 different jobs coordinators. It is possible that a couple of projects could have the same jobs coordinator. And the work that we're going to be doing in particular here is to help each of those projects and the jobs coordinators sort of unify some of the resources so that we can take advantage of the cooperativeness, if you will, of sharing information so that if there's opportunities on one project today and not another project, we can kind of focus all of the resources towards that one project. We're also going to be helping the county better understand how the resources are working together. So we're going to be developing a dashboard. I think the dashboard is going to be shared with members of this board at some point. We're looking for input, in fact, from members of the board. If there's a particular interest of some aspect of a project tied to jobs that you're looking for, please let us know. You can pass it along to Isidro and he'll pass it along to me, or you can let me know, or you can let Alicia Ramos know at the county. So all of that to say, folks, I don't have a presentation to show you today. We'll probably come at some point in the future and be prepared to give you a little bit of maybe more visual information about how we're going to be doing this. We're going to try to help everyone help each other. And then we're going to try to help the county and you understand, with all the resources dedicated to economic development, in particular for jobs programs for these projects, how is it that, how are the allocations that the county is focusing and resources that the county is focusing on these efforts, and what you're doing, how is that working? Is there some value? And there is. We're going to help you quantify and qualify that on maybe a broader perspective. The jobs coordinators, again, do it for a particular project. We're going to help the jobs coordinators collaborate together. And so a year from now, we're hoping to be able to show you exactly all the efforts over the next couple of months, what happened with that. So Isidro, with that, I'll hand it back to you, and I hope to get back to the board sometime soon with a more formal presentation.
Thank you, Joe. Thank you for joining on short notice also. So I appreciate you coming on and introducing yourself. So thank you. Yes, and so we have Modern Times, and then also we have a 30 and Dangler project, again, that is scheduled, I think, to begin construction in June of this year. And National Corps is helping our Community Development Authority Department Commission with that project. And what National Corps has done is brought on a, can you still see my screen?
Yes, it shows Modern Times.
Yeah, it shows Modern Times, right? Okay, okay, there we go. So they brought on a labor compliance consultant, Los Angeles Housing Compliance, which is an independent consulting firm focused on local hire, local business development, outreach, and prevailing wage compliance. Here with us today, I believe we have Margaret Toddy. So I'll turn it over to her to introduce herself and maybe her team and talk a little bit about the Third and Dangler project.
Thank you so much, Isidro. Hi, everyone. My name is Margaret Toddy. I am the president of Los Angeles Housing Compliance. We have Adriana Aguilar on the line as well. She is going to be running local hire for the Third and Dangler project. So a little bit of information about our company. I have a background in general contracting. I've worked for general contractors, building multifamily affordable housing in Los Angeles for close to 20 years. As a compliance officer, I did many local hire programs. Moving into project management, I worked at the Jordan Downs redevelopment, and we had a 70% success rate on our Section 3 local hire there. We hired 43 people from Watts and Jordan Downs, and I was able to leverage that experience to start a business focused solely on local hire and economic development, which I'm so excited about. So we are partnered with National Corps on the Third and Dangler project. At this point, the project is set to start in June of 2021. Our focus is on building pipelines with the task force partners that are a part of Third and Dangler. So Adriana, who's on the line with us, is doing special needs assessment.
Let me turn down. I'm watching HICP and working on the budgets and such.
Okay. I just realized that they want last 5 years for these congruents.
Oh, can you please
POD, General Hospital, and then.
Can you guys hear me okay? Thank you.
Yeah.
Okay, great.
I'm on mute.
So we've been focusing on the task force partners. Adriana has been reaching out to them to talk about their needs as it relates to resources. As task force developers are sending us referrals for the positions that will be opening up, we want to make sure that they have all the resources available for those candidates, for boots, tools, union sponsorship fees, everything that people need to be successful in the work. So we're doing those special needs assessments now. We're also working with National Corps to do formal bid commitments for Section 3 or a targeted local hire within the 2-mile radius. So we're gaining those commitments now during the bid process so we can really leverage that and gain the most commitments. And that way we can hit the ground running. So, you know, our focus is on retention. We do new hire orientations. The first day of work, we're really, the company is based in supporting the foremen in their work, supporting the field, and making sure that we're celebrating everybody's efforts. We do that through newsletters, awards for the foremen and superintendents, and we're really excited to be a part of the project.
Thank you, Margaret. Thank you for that presentation or introduction. And then obviously, thank you for joining the meeting on short notice. Again, I remind everybody that there is a subcommittee on the local hire and targeted worker projects. So if anybody's interested, again, please let us know. I'll stop there because I know we're short on time, and then I'll turn it over to Heather and then or Ozzy, who maybe might have some information to share as well. Thank you.
Thank you guys so much. Very exciting to be introduced to Joseph and Margaret and your teams and your organizations. This is something that's been a high priority of high priority interest of the Health Innovation Community Partnership since its inception. And it's so exciting to see what wonderful progress is being made. Definitely, Ozzy, do you have comments that you'd like to add in light of these presentations? Ozzy, you might be muted. We're not hearing you.
I'm sorry about that. I did a double mute to make sure that I wasn't you wouldn't go over. But great presentation. I'm happy to see that the work is continuing to move forward. I did prematurely share in the chat, but would like to bring it up that I'm sharing a report that the County of LA, Isidro, and Carolyn, in partnership with the Los Angeles Economic Development Corporation, put together, which focuses on a pathway for economic resiliency. It's a very good report that I would encourage all of you to take a look at because it aligns, it provides a forecast of pre-pandemic, post-pandemic, during pandemic and post-pandemic in terms of what the job market is going to look like and the opportunities for growth. And I believe that it's somewhere along like pages 22 to 25 where it specifically focuses on healthcare. So for the nonprofit organizations, the community-based groups that are on the line, it's a really good report that provides the data on what it is going to look like of moving forward as it relates to healthcare pathways here in Los Angeles County. And the scope of work that I've been focusing on and working on specifically is how can we create bridges to leveraging opportunities for our residents, our students, our student population within the community colleges in those related fields. Going a little bit over a month ago, we coordinated a phone call with Los Angeles County, with LA County representatives, Isidro being one of them, and Carolyn being another, and the community college campuses from across the district. There are 19 community colleges in the district. We were very fortunate that out of the 19, we had, I believe, about 9 that participated to look at the approach that each individual college is taking and seeing if there could be some alignment and coordination with the county. So that conversation is taking place, and I'm happy to report that based on that conversation, today at 1 o'clock, we're having a secondary conversation with the city of Los Angeles, and where the county and the city are going to have a conversation on the individual approaches that their governance bodies are taking to bridge the healthcare pathway shortages that we're facing with, and seeing if there could be some strategic alignment there. So from our end, we're really looking at how can we create opportunities for employment into these very critical job opportunities that exist. And as more information continues to come into those from those discussions, definitely would continue to appreciate the opportunity to report back to the HICP, as I think that the membership and the members that are part of your community-based organizations or community-based groups can definitely benefit from being able to participate in those trainings should they wish to do so.
Great, thank you so much, Ozzy. It is an exciting time, and we have seen such great progress, and it's wonderful to see these training opportunities coming online as well. It's really the marriage of opportunity and development, and really empowering our community to have those those real fair wage jobs that are person and family supporting. So very exciting stuff. Once again, for those that are interested in joining the local and targeted workforce development committee, please go ahead and add your name, add your email and name in the chat, and we'll make sure that that gets passed along to Isidro and his group. Those committees are meeting, in general, at least monthly, if not more frequently, depending on the need and what's coming up in the pipeline. With that, I think we are at the end of our agenda for today. Are there any final comments or sharing from our partners today? Okay, with that, I will ask my colleague Ana Parra to go ahead and share our meeting feedback poll, as we do at the end of every meeting. You can give us your feedback as to how today's meeting was for you. And also always remember, you can add fresh ideas and other presenters or topics you would like covered in the chat, and we'll make sure to take those into consideration at our next co-design meeting as we design the April agenda. We'll also be sending out a complete set of the meeting materials later today, and it as well will be posted on our website along with the meeting notes and the chat transcript. So please stay tuned for that. And of course, next week we will, next month, we will be meeting first Friday of April, which is April 2nd at the same time. Meeting room opens at 8:30, meeting starts at 8:45. We're going to be having a presentation on the Women and Children's Hospital ceremony demolition, as well as some transportation updates and other wonderful topics. So we certainly hope you can join us there. With that, I believe we are done for today. Happy March, happy Women's History Month, everyone. And we look to have a wonderful and blessed weekend, and we look forward to seeing you in a month.
I'm sorry, today the polling feature is not working for us, so we have a break from a poll.
Okay, well then that gets us out of here 1 minute early. So
yes.
Thanks so much everyone for staying through to the end. And thank you again to our fabulous presenters and our guests today for always making this a really rich learning experience for everyone involved. With that, goodbye.